Women's health issues. Women and men share many similar health problems, but women also have their own health issues which deserve special consideration. Women's lives have changed over the centuries. Women are now more educated, are in the workplace in larger numbers, have fewer children, and are co providers or even sole providers for their families. As gatekeepers to home, the health of women also influences the health status of other family members, including those of children and aging parents. Gender is one of the most important sociocultural factors that impact health. Thus, there is a need for culturally competent medical care and prevention services that are specifically tailored to women. Now let's look at gender, income, and health disparities. Women outlive men by an average of 6 to 7 years, and this longer life expectancy may be due to hormonal differences, physiology, lifestyle, and health practices. Women have lower death rates than men for each of the 10 leading causes of disease. And they also smoke and drink less alcohol than men. However, they are at a greater risk for Alzheimer's disease and are 70% more likely to suffer from major clinical depression than men. Now, this higher prevalence may really be due to the fact that women probably are more likely to get screened or recognize the symptoms and go in for help more than men. Women of childbearing age spend 68% more in out of pocket health costs than men, namely for birth control supplies. After heart attack, women and men of color are less likely than white men to receive diagnostic and therapeutic procedures and cardiac rehab. African American women are nearly 3 times as likely to die from pregnancy complications and childbirth as white women. And Native American, African Americans, and Hispanic women are more likely than white women to receive inadequate prenatal care. Higher income women are more likely to be insured than lower income women, primarily because of their jobs paying more, but they also may have spouses who are high earners that have health insurance benefits that cover the family. Higher income women are also more likely to see specialists and be referred to a specialist than lower income women. And women experience higher poverty rates than men. And there is the concept called feminization of poverty. And there is a handout specifically about feminization of poverty. Essentially, when we look at poverty, there are more women below the poverty line due to a host of factors. Health-seeking behaviors. The health and well-being of women are affected by cultural norms and traditional gender roles and expectations. In many cultures, women are the gatekeepers to the home, family, and society. They're also the healers and the storehouse of the oral traditions. And women are socialized to take care of children, their men, as well as their parents and other elders. The saying behind every healthy man is a woman rings true in many families. Studies consistently show that wives and female partners are significant sources of health and nutrition information for women. They also provide social support, make medical appointments, and accompany them to medical visits. However, they often do not give themselves the same level of tender, loving care. Women's culture also allow women to talk openly about health issues and to share information with others, solicited or otherwise. So, for example, women will talk about their mental health and emotional health with other women. They will ask about pregnancies. They will talk about reproductive issues. And women enter the healthcare system and use preventative care earlier and more often than men due to issues of puberty and family planning. They also read about health topics and watch more health related TV shows than men. Women's health issues. Women's health status vary by age, culture, race, ethnicity, socioeconomic status, and geographic location. The top causes of death in US females are heart disease, cancer, stroke, chronic lower respiratory diseases, Alzheimer's disease, which has shown a significant increase over the last few years, unintentional injuries, which also have shown a significant increase, diabetes, influenza and pneumonia, kidney disease, and septicemia. Major health issues: heart disease, stroke, hypertension, cancer, diabetes, HIV/AIDS, depression, and menopause. Recommended health screenings: annual checkup, annual pap smear. And a pap smear is usually done to detect cervical cancer. And it is recommended that cervical cancer screening begin at age 25. Immunizations are also recommended. Flu shot every year starting at age 50. Tetanus diphtheria shot every 10 years. Pneumonia shot once a year at age 65. And hepatitis B if needed. Blood lipid levels should be checked at least every 5 years starting at age 35. Check should begin at age 20 if the woman is a smoker, diabetic, or has a history in her family of heart disease. Colorectal cancer screening should be done starting at age 50. However, if there is a family history of colorectal cancer, screening may be recommended earlier. Breast cancer screening: annual breast exam or clinical breast exam by a healthcare provider, as well as monthly self-breast exam by the woman. And women should talk to their doctor about the best time to start getting regular mammograms based on age. 40 to 44, women can choose to start. 45 to 54 annually. 55 and older every 2 years, or the woman can continue annually. This also may be impacted by health insurance coverage. Diabetes tests should be done if high blood pressure or high cholesterol is also present. Depression screening should be done if a woman is feeling down for the last 2 weeks, and it's much more than a case of just feeling the blues or a bad breakup. And women who have had a baby recently may also want to be screened for postpartum depression. HIV test should be done if sexually active, and the healthcare provider would make recommendations as to how often. In summary, culture shapes the way that women perceive and respond to illness. Gender is one of the most important sociocultural factors that impact health. And gender also affects the high poverty rate among women. Women have significantly healthier lifestyles than men, are more likely to participate in preventive health screenings, and are more willing to seek support in situations in which help is needed.